This is a press release from the Medway NHS Trust telling us about their brand new critical care unit that cost them £500,000. I said, what does that mean? What does that involve? They said, come and join us for the day. We'll show you what we do.
Hello, Bronte staff nurse speaking.
A few deep breaths in and out. Nice and deep.
He's too sick, really to go on a ward.
A shift starts at 7 a.m, but within minutes a patient arrives from A&E.
I had a bit of a problem with my heart when I had to get out of bed this morning.
His family call,
and when he came in, his heart rate was quite high.
And the consultant sees him at the start of his rounds.
I just want you to breathe quietly for the moment.
Dennis is the sort of patient this unit was designed to help. He's receiving specialist care and benefiting from a high nurse-to-patient ratio.
It's been shown that if you concentrate the critically ill patients who don't need intensive care in one area and staff it appropriately, then they do far better than having one or two scattered around the hospital on individual wards.
It's one nurse to two patients, so they can dedicate their skills to those two patients, whereas normally on a ward you're dedicated to 12 patients.
One of Vicky's patients today is seriously ill.
I'm in here for Hodgkin's disease and breathing's not too good.
I think you're utilising your skills a lot more than you would on a general ward. You get to know a lot more about what's actually going on inside the patient's body and then can relate that to the sort of nursing interventions that you're carrying out.
The government is spending £50 million to try to double the amount of time nurses spend on direct patient care. Medway are convinced the £500,000 they've spent on the Bronte ward has achieved that for some of their critically ill patients.
When you're a very sick patient on a ward of 25 patients who perhaps have 3 nurses on overnight, then you can't possibly give the dedicated care that you give here. And for that reason, I'm sure it's worth the money that's spent.
The patients who've already passed through appreciate the care they've received, and the Trust are so pleased with the results, they hope to double the number of beds at some point in the future. Mark Norman, BBC South East Today, Gillingham.